from scratch, but in less than 2 years, he has led it in such a way that it has reached great heights, and almost all of the complex cardiology procedures are being done here now. He, with his vast experience, has been guiding other departments of the hospital and management like a guardian. It won't be wrong to say that he has been instrumental in functioning of this hospital from the beginning. Sir, please, you are welcome. We are ready to hear you.
A very good morning to all of you. Thank you, Shraddha, for those very, very kind words. In the august presence of our esteemed captain, Dr. Naresh Trehan, CEO Pankaj Sahni, all the luminaries from Bihar and Gurugram. It's a blessed day for all of us from Medanta Heart Institute as we rededicate ourselves to the service of the people of Bihar. This has been made possible by a non-resident Bihari, our own Dr. Naresh Trehan, who cares more for Bihar than a lot of us. He has made it possible by establishing a world-class healthcare facility, Jayaprabha Medanta Hospital, an infrastructure which is second to none. It's a teamwork, and I'm very proud to say that the entire team of Heart Institute, both cardiac surgery and cardiology, we work 24/7, 365 days in a year, and we are there to take care of every possible issues that anybody will have as far as heart is concerned. Our cardiac surgery team, led by Dr. Sanjay and Dr. Rajiv Ranjan, not only have the skills to take up the most challenging cases, but have also shown a dedication and commitment which is rarely seen these days. For them to take up a critical case in the middle of night is not an exception, but a routine. And I vividly remember when they took a COVID positive aortic dissection case in the middle of the night, a young lady doctor, and operated throughout the night and saved her life. So this is not an exception. This is what we do. Both cardiology and cardiac surgery team is there 24/7. Our labs, our OT is open 24/7. So with the teamwork which they have, they are now capable of handling every kind of cardiac surgery issue which anybody will have. So anything that you think needs to be done, we are always there. Our cardiology team has also shown again to the state of Bihar that with the sincerity and commitment, anything is possible. I'm very proud of my entire team, Dr. Ajay, Dr. Shaheen, Dr. Samshad, Dr. Pawan, Dr. Vijay, Dr. Shraddha, Dr. Dipashri, Dr. Shushil, Dr. Shreyas, and every member of my team, nurses, my technicians, everybody works as a well-oiled machine, good team, and we are very proud to say that we are second to none in the whole country. Ours is the only institute in Bihar where an interventional cardiologist is available in the hospital round the clock, and we are there to take care of all cases of heart attack. And we pride ourselves in saying that this is the only institute where our data will show you that we can do a primary angioplasty in 30 minutes of a patient entering our hospital. It has been a very challenging but very satisfying journey so far, and we'll continue to serve our motherland to the best of our abilities. I'll just show you some of the data from our institute. This is a team, both our cardiac surgery team, our interventional cardiology team, all our nurses, technicians, they're all there, and you can see the smile they have because they are very proud of what they are doing. Our journey so far, cardiac surgery has done about 525 cases. CABG is 379, 4 on pump. CABG plus MVR 27 plus AVR 5, MVR itself only 40, redo MVR 2, AVR 20, DVR 21, Bental, which is a very complicated procedure where you take care of the aortic dissection, whole aortic root is changed with a valve, they have done 7. VSR, that is the ventricular septal rupture, CABG plus ASD, a lot of complicated cases, VSD, LA myxoma, cardiac rupture, RSOV, redo AVR, everything is whatever is needed. You can see the whole spectrum of cardiac surgery is being taken care of. Cardiology, again, we are very happy to say that we are growing. Our OPD in the year 2021, which was just a few months, was 1879. We did about 15,000 OPD cases in 2022. In this year itself, in last 3 months and 3.5 months, we have done about 6,000 OPD visits have been there, and we hope to reach about 25,000 this year at the end of this year. Our cardiology data, we've done about 2,500 angiograms, 923 PTCAs. IVL, that's a special lithotripsy when we, break the calcium in the coronary arteries, is 3, 5 rotas, rota plus IVL1, OCT3. IVUS we use very routinely, almost 10 to 12% of our cases have IVUS, 94. Left main, we have done isolated left main, unprotected left main, 20. On IABP, we are very aggressive in taking these sick patients. We have done 75 angioplasties on IABP. 2 ECMOs have been done, and there are 2-3 more which ECMO has been done. 218 pacemakers have been implanted, 23 AICDs, 19 CRTDs. We have started doing LBB pacing, which Dr. Shaheen will be telling you in more detail. It's a unique way of taking care of the conduction abnormality as well as the LV dysfunction, which we do routinely now. LBB pacing plus CRT is another modality we do. In one case, ASD device closure, 8, PTMC, BMV, 18 cases, balloon pulmonary valvotomy in a 1-year-old child is 1. So we are capable of taking care from 1-year-old to 90-year-old patients. That's what we have covered. And we are planning to expand our services by inducting an electrophysiologist, a pediatric cardiologist, and we will continue to serve you to the best of our abilities. And thank you very much for trusting us and being our trusted partner in this journey. Thank you very much.
We'll take forward the cardiac session from here on. PPT projection. So we'll start the cardiac session now. First, I'd like to tell you about my department advances in non-invasive cardiology. We'll take it very briefly. We have done around 20,000 procedures in the last year, but it is not about the number. It is actually the arrival of advanced echocardiography in Bihar. So transthoracic echocardiography is the basic test which everybody is doing. Then stress echocardiography, contrast echo, transesophageal echocardiography. These are very useful modalities, but very underused, especially in our region. But we are doing it on a regular basis and with amazing results. And the last 3, which we can see as strain imaging, 3D echocardiography, and 4D auto LVQ. This is something which we have started doing it for the first time here in Bihar, in Medanta, Patna, with our amazing machines. I'll just give a very brief about strain imaging. It is something which detects subclinical LV dysfunction. We know that LV ejection fraction is a robust parameter, but it detects myocardial dysfunction too late. It is something when the damage has been already done. So strain is very amazing in this way that it detects In a normal EF also, if this strain is come, it means that the myocardium is at jeopardy. It has an amazing prognostic and diagnostic value. So like of a patient, recently he was referred to us. He was dyspneic, he had anemia, had body ache, has lots of reports from everywhere. The ejection fraction was normal. But when we did his strain, it came out to be very reduced and it was suggestive of cardiac amyloidosis. And when evaluated, he was found to have multiple myeloma actually. So this is the power of strain imaging, which we are doing regularly. It is not theoretical. It is put into practice daily in our labs. Then 3D echo. 3D echocardiography is an amazing tool in our machines which helps us to see heart from inside. It's like that we are seeing it in face. Like this is a mitral valve which is of a patient of rheumatic heart disease. So that it improves our understanding of disease immensely. We can see that valve is thickened, the edges are upturned, uprolled. And sometimes it is very useful practically, like a patient of ASD comes and we have to see whether it is deviceable or not. And very innocent looking ASDs, it looks like on 2D that it can be the device can be put. But when we do a 3D, the first picture is that it is fenestrated. The second we find a membrane called triatriatum. So certainly these patients are not suitable for device. So 3D can unravel the secrets. And then it is very precise, like in this picture, we can actually see mitral regurgitation coming from the valve, going into left atrium, and we can pinpoint from where it is coming. So what is the use? This is the future. All the percutaneous structural heart interventions, their 3D echo is indispensable, be it mitra clip, be it TMVR, be it left atrial appendage occlusion. So this is what we are talking about. This is what our vision is. And 3D echo helps us in that a lot. We have already done 2 towers. And in Medanta, Gurgaon, all the percutaneous interventions are going on. Then this is a technique 4D auto LVQ, which actually reconstructs the left ventricle of a patient. And in the first, we can see it is a normal heart. And the second, this was a patient of Takotsubo cardiomyopathy. So the base is contracting, the apex is not. So this is actually something like non-invasive LV angiogram. So these are the newer techniques which we are doing on a regular basis in our hospital. And we're also sharing our experiences. Last year, we did a workshop which was very successful. And we'll be doing it again this year. So thank you. Thank you for listening. I will resume my duty as a master of ceremony and now we'll resume the session. I would like to invite our chairpersons for the next session, Dr. S.S. Chatterjee.